Is digging deeper this morning as there's a new program to respond to the rise in gun violence. The Gun Violence Behavioral Health Response Team was created by the Multnomah County Behavioral Health Division.
They say that the health department has a role to play in addressing issues of survival, and that includes gun violence. Joining us live now to explain more about this is Interim Director of the county's Health Division, Julie Dodge. Good morning.
Good morning.
Yeah, first of all, let's define the problem. I mean, how bad is the gun violence problem in Multnomah County right now?
Well, I think compared to what we're used to, it's significantly worse than it has been. Although we also see, an increase in gun violence across the country, and we see this in part as a response to the pandemic and the ongoing isolation, lack of social supports, and lack of access to resources that people have experienced over the last 18 months. So we see people responding to that in different ways, and for some youth and adults who haven't had the supports they need, it might come out in more violent ways.
So tell us about this new program and why the choice to incorporate public health into the lens here of addressing this problem.
Well, one of the ways of interrupting and preventing further violence and interrupting continuing violence is to be working directly with the people who are most impacted. On the behavioral health side, our new gun and gang impacted families program will work with youth and families who have been impacted by gun violence, whether because a family member has been shot and killed or harmed, or a family member has been involved in some kind of gun violence. And through connecting them with a therapist that represents their cultural background, we hope to be able to interrupt that pattern to help the family to heal and to help prevent people from acting further.
Now, what you're describing is after the gun violence has occurred. Are there any preventative measures that are incorporated as part of this program?
Well, our portion of in behavioral health we see as preventative in that we'll be serving the whole family. So if there are younger siblings involved, hopefully preventing them from taking the same path as a friend or a family member already has. On the public health side, there is also an outreach team that will be working with the communities to work on more preventative work.
So preventative
all
in
of
the
our
sense
work,
that you're kind of trying to intercept that ripple effect that we could see from initial cases of violence. Is that a pattern that we're seeing in Portland right now?
A ripple effect? It always has been. When one person is harmed, we often see retaliation, especially when it's related to gun violence. All of the work that we do is embedded in a network of community partnerships. Part of our behavioral health response will include working with what we call credible messengers, people who have lived experience in culturally specific groups from African immigrant to African American and the Latinx community, so that we're all connected to one another and talking with one another and kind of creating a larger umbrella or safety net around our families and communities.
Well, we're almost out of time, but we want to know when this program will be fully up and running and how can people find out more?
Well, we hope to have our therapists that will be working in this space hired by the first of the year and operational. And then our credible messengers or our community partnerships are already being contracted out. So those are starting soon. For more information, they can call our call center at 988-4888.
And those are good resources too for anyone who needs to find help there and get into some resources. Thank you, Julie, for your time this morning, and we look forward to following up with you as this program gets put into practice.
Thank you so much.